She remained in ICU for 55 days at a cost of $22,000 a day, which in time amounted to more than $1.5 million. If we had had a public option that would compete with big insurance, Jenny would have been able to afford health care.
Good afternoon. Welcome to the beginning of 3 special events that the Campaign for Better Healthcare is holding as part of our 20th anniversary. We've been fighting for 20 years for healthcare justice for everyone.
I'll pass that down, Pat.
As our theme for our 20th anniversary states, we will not complete our mission until everyone is in, nobody's out. The healthcare system has to work for everyone. These are exciting times. We are on the verge of historic proportion in Washington that will have a profound effect on not only 36 million Americans who are uninsured, but the rest of our society as well. Once we pass reform in Washington, the implementation and fine-tuning of that plan falls to our elected officials in Springfield, and particularly to our governor. The first part of our celebration is this gubernatorial debate. For the record, we did invite the 3 leading Republican candidates, and all declined our request. Boo. We'll be in big trouble if something happens, if they end up being in charge when we have to do our health care reform, simply because they didn't come. We all know that the health care debate will not end with the passage of reform in Washington. Thus, we plan to hold additional debates next year with the chosen candidates of the Democratic, Republican, and Green, and possible other parties as well. So before we begin with the debate, I would like to introduce Jim Duffett, our esteemed Executive Director of the Campaign for Better Health Care.
Thank you, and welcome, and good afternoon to all of you. I want to also thank Governor Quinn and Comptroller Hynes for accepting our invitation. And as Robin said, we did invite the leading candidates from the Republican Party, or the names that we got from the Republican Party, and we do plan to have a further debate next fall between the leading candidates for governor. By that time, health care reform will have been passed in Washington, and we'll begin the process of implementing here at the state level. We do realize that health care reform is going to be a major issue in next year's election. And the focus is going to be coming back at the state level on not only implementing the federal law, but there is going to be some latitude on what states can do. And we also know that the federal reform is not going to have everything in it that we believe should be in it. And the role of the state can be to expand different benefits and services for people. I also don't want people to be complacent at all, and don't want us to be getting ahead of ourselves as we're going to talk about some of the questions about what a role of a governor can do here in Illinois. We still have a lot of lifting to be able to be done in Washington to pass reform. And we're going to be discussing, as Robin said, much more in detail about that. And as people probably know, that right now as we're speaking, Senate President Reed is going to be announcing the CBO numbers for the Senate bill, and then the Democrats are going to go in caucus, and it's his goal to start the debate on Friday or this weekend in the Senate, and to conclude with a vote by the middle of December. We're urging a lot of people, all of us, to call your House members and who voted in favor, and you'll see those individuals in our ad book, and thank them, but hold them accountable, because I would say there's at least 3 of the Illinois delegation that we're not sure if we're going to get their vote in the end. We think we will still, but we need that pressure to keep up, because we know the teabaggers and the opponents of reform are not going to sit idle. They're going to be intensifying their efforts. So we need to thank our elected officials and keep on pushing them. In the Senate, we must make sure that both our U.S. senators step up their support and pressure to make sure that the Senate proposal is at least as strong as the House proposal. And frankly, there are different amendments and things that can be done in the conference committee report that if you're not on our listserv, please sign up for our listserv, and you'll be getting information about that. As I mentioned, when reform does pass, the focus, at least the campaign is going to be doing, is going to be at the state level. We know that this is not going to be politically easy, and we know it's not going to happen overnight. But leadership in the governor's mansion and under the Capitol dome is going to be very vital. And we must not back down to any fear-mongering, hate, or scare tactics, and downright ignorance coming from the teabaggers and the insurance industry lackeys. I can tell you that this is even going to get worse over the next 6 weeks, the rest of this month and in the month of December. And we also know that health care is the key to economic opportunity and security. And I know with your help, we're not going to back down at all. Lastly, I want to introduce someone that's very special to the campaign and to many people. You know, one of the hardest things for anyone to do is to share their story. And each story has its own level of intensity, horror, outrage, anger, and grief. And I'm humbled at the hundreds and hundreds of people throughout the state of Illinois who shared their story, their personal stories, as part of the Campaign for Better Health Care's Story Share project throughout the year. And one of our story sharers is Midge Howe, who wanted to share her story both to you, Governor Quinn, and Comptroller Hynes. And when you guys are making tough decisions, I hope you'll remember Midge's story that will reinforce your judgment to do the right thing. I want to say this is not up on our website yet, but it will be up possibly on Friday. Last Saturday, Midge went to a town hall meeting that Congressman Lipinski had, and she told her story, which you will hear it. She was heckled. She had insults hurled at her and other demonizing acts of inhumanity. It's appalling, and we're not going to allow that to happen, and we're going to make sure that health care reform passes. Midge?
Welcome, everyone. Thank you, Campaign for Better Health Care, for inviting me to speak on your 20th anniversary annual meeting. I'm really pleased to be here today. Thank you, Governor Quinn and Comptroller Hynes, for being here. And I'd like to just share my story, as I tried on Saturday. My name is Midge Huff, and I live in downtown Chicago. And I'm going to share a story that was my own family's personal tragedy. It's about Jenny. Jenny was my 24-year-old daughter-in-law and her unborn baby, and they died 9 weeks ago. She leaves behind a 2.5-year-old daughter, Kylie, and her husband, Sean, who is my son, who has not been able to accept this terrible outcome and is very depressed. Their daughter will never know their mother. Jenny no longer has a voice, so I will speak for her today. Jenny died because she did not have health care or health insurance and did not have access to health care treatment. My son had lost his job, and she was already pregnant, and it was considered a pre-existing condition. If Jenny had had guaranteed access to quality, affordable health care, which is what a strong public option will give us, she would still be here with us today. There's no question. Because she did not have that access, she was forced to go to an ER. Jenny was 7.5 months pregnant and was not feeling well. She went to a for-profit hospital and was honest in saying that she did not have insurance. They took her in and they examined her. They listened to her chest, did an x-ray, and turned her away saying she had a cold, maybe a touch of bronchitis. Less than 24 hours later, Jenny was much worse. Her husband, my son, took her to another hospital in town and lied about having insurance because he was terrified. They examined her and admitted her immediately with double pneumonia, sepsis, which turned into septic shock by that night, and respiratory failure. By that night, Jenny was in very critical condition and on a respirator, fighting for her life and the life of her unborn baby. She remained in ICU for 55 days at a cost of $22,000 a day, which in time mounted to more than $1.5 million. If we had had a public option that would compete with big insurance, Jenny would have been able to afford health care, and she would have had access to a primary care physician and treatment. She would not have ended up in the ER. In the end, Jenny lost her courageous battle. She had had a heart attack. She had a brain bleed. She had a stroke. The baby died in utero. And we were forced to remove her from life support, even though she was very aware here. But the pain was too intense. So there's nothing that I can do, my son can do, my husband can do for Jenny now. And that's one of the reasons that I speak out. I try to be Jenny's voice and present a face. I carry a poster with me when I go out with Jenny's picture on it. And people identify with the picture, not just the statistics. I am fighting for hundreds of thousands of people who have been turned away by their insurance companies or go without care because they cannot afford health insurance and are suffering every day. For too long, these people have been faceless and voiceless in this country. Please don't let there be another Jenny. Don't let other families suffer as we have. We need a system that puts patients before profits. And I think that the public option will offer that. Right now, insurance companies are making millions while many go without protection. Our existing system passes the cost of uninsured to the public, and they pay the bills in the form of taxes and higher premiums. It's interesting, as I've gone out and I've spoken, I hear people say, well, you know, you didn't have insurance and you can go to an ER, or there are free health clinics. That's just not the case. You saw what happened when she went to an ER. And the health clinics are overburdened and underfunded. So there's months of waiting to get into those. So there was no option for her. There are so many people that have insurance and get denied for pre-existing conditions or for whatever reasons the health insurance companies decide they're going to do that. If my husband and I were to lose our jobs, we would then be offered COBRA at a cost of over $1,000 a month with a deductible. Without income, how would we afford that for very long? We wouldn't, and we would be just like everyone else. People say that all you need to do is go to a free clinic, and of course I've covered that. That doesn't work. It's obviously that our healthcare system is broken. Everyone knows that. Every day I work for the healthcare reform for all Americans, and they need it and they deserve it. Since losing Jenny, I have attended every rally. I have networked online and through social media. I've spoken at events, spoken to congressmen and senators. I've been on TV, done videos, been in newspapers, given interviews. There's nothing, as I said earlier, that I can do for Jenny, but I can use my voice and give voice to the voiceless at this point. So I'm driven to do that. I first met Campaign for Health Care, for Better Health Care, excuse me, in front of Blue Cross Blue Shield in early September after losing Jen. I was standing there lost in so many emotions, with people coming at me from every direction wanting to talk to me. A young woman approached me. I was just kind of standing there. A young woman approached me, and she was from Campaign for Better Health Care, and that was Rose Kalin. I hope I said that right. A wonderful young woman. And she invited me to come to the office and to share my story, and I agreed because I really didn't know where to go from there. Since that time, Campaign for Better Health Care has helped me in so many ways. They've guided me through the process, putting me in touch with media so that I could share Jen's health care story and maybe educate people that didn't know what was going on. With their help, I was on two CBS programs. I was offered story sharing training, which I badly needed, and have been given wonderful guidance from all members of their staff. Their support and advice has helped me to become a more effective speaker as I continue to be an advocate for health care reform. We together as partners, working together as partners, we project the message of reform, and we can and have made a difference. We have made a difference. People are listening. In addition to providing the tools and opportunities for advocates like me to make my voice heard for a health care debate, Campaign for Better Healthcare works with legislators and organizations to create policies that support the American people. I've learned that they also run a statewide helpline to help individual families who are uninsured and underinsured find affordable health care resources in their community. This is priceless to those who don't know where to begin in a crisis situation, and I kind of know that myself. I've been able to spread that information knowing that through online media and in different ways at different things, and I've found so many people that need this help. The work of Campaign for Better Healthcare is so important, and I say that again, it is so important. And the only way the campaign can continue working for health care reform is with your support. Please, please consider donating to the campaign so they continue to fight for quality, affordable health care for all. In celebration of 20 years of hard work and the historical events in health care legislation that we are experiencing now, I'm asking you to please give today. Help them to continue to make a difference. If given today, all donations will be matched by Community Memorial Foundation. I'm asking on their behalf and for all the Jennies out there that need their help. Enjoy today's event, and thank you for letting me share my story with you today.
Well, Midge, thank you so much for sharing your story, and I am so sorry for your loss, and greatly admire and am inspired by your work, by your ability to continue this fight. So thank you so much. I am going to briefly introduce the governor and the comptroller now. There is a biographical information in your packet, so I'm just going to highlight a few things. First, I'd like to introduce Elizabeth Brackett, the moderator. She is a NewsHour correspondent since 1984. Elizabeth Brackett covers politics and urban problems. She has reported on a wide range of stories, from white-collar recession to the controversial French abortion pill RU-486. She received a Peabody Award for her coverage of the 1988 presidential campaign and an Emmy Award for her reports on farm issues. I'd now like to introduce Pat Quinn. Governor Pat Quinn has devoted his life to standing up for the working people of Illinois and fighting political corruption, government waste, and unfair taxes. He has earned a national reputation as an honest leader who has never been afraid to speak his mind and battle special interests on behalf of everyday men and women. He has held numerous elective offices. First, he served, his first elected office was with the Cook County Board of Property Tax Appeals. As a commissioner, he instituted a tough new ethics code, professional auditing standards, and a vigorous taxpayer outreach program. During his term as Illinois State Treasurer, Quinn spearheaded passage of the Illinois Whistleblower Reward and Protection Act. Pat Quinn became Lieutenant Governor of Illinois in 2003, and in that role, his role as the state's top elected advocate for Illinois' military men and women and their families. Pat Quinn was sworn in as governor of Illinois on January 29, 2009. Governor Quinn has spent his life making government more accountable to the taxpayers. Comptroller Dan Hynes is serving in his third term as state comptroller. As the state's chief fiscal officer, Hynes has become the state's leading voice for fiscal responsibility. In the process, he has focused his administration on consumer and taxpayer advocacy, government accountability, and long-term budget reform. Hynes believes the Comptroller should be a watchdog for taxpayers and consumers. Some of the issues Comptroller Dan Hynes has led include securing state funding for stem cell research, proposing a legislative package of reforms that attacked pay-to-play politics, prohibiting tax scofflaws in government and corporations involved in financial crimes from getting state contracts, engineering the creation of a rainy day fund, which we could certainly use now. During his tenure, Hynes has expanded the state's commercial direct deposit program, encouraging state vendors to receive their payments electronically, thereby saving money and increasing efficiency. Comptroller Hynes has effectively and efficiently fulfilled his role as State Comptroller. So please let's welcome everyone on the panel.
Okay.
All right, let's begin the fun part of the afternoon. But first of all, my condolences to Midge Huff, and thank you so much for sharing your story. So the rules for this debate are each candidate gets 3 minutes. I get to ask one follow-up question if I want to. If you want to follow up on the answer, you have to wait till your next answer and take a little time out of that one to do it. And now we're going to flip the coin to see who goes first, and the person who goes first will go last in the closing statement. Ready? Whoop. Harder than I thought. All right, I know it. Okay. Heads or tails?
Tails.
Yeah. Then you get
Heads,
yes.
yes.
And you go first.
I go first?
Right. So why don't you first begin with your opening statement, please?
Up there.
If you'd like.
Thank you very much, Elizabeth. Thank you all for being here. I want to thank the Campaign for Better Healthcare for convening this forum and for all of your great works on behalf of moving the agenda for universal health care, quality health care, and fairness and equality for all. And I want to also commend Midge for her courage in telling her story and her commitment to making sure that Jen's life and her tragic death moves all of us towards fighting for health care and making sure that all governmental leaders remember the personal lives and the personal stakes in the policy decisions that we make. All of you are here and are members of this fine organization because you have a passion for health care. I share that passion, a passion that has embedded me from my parents, the way I was raised, but more as an adult in terms of what I've chosen to do in my profession and who I've chosen to be with as my life's partner. I was a healthcare lawyer before I became Comptroller. I worked with hospitals and physicians, other healthcare providers, mostly in their business transactions to make them competitive and to make them thriving organizations, but also in trying to work through regulatory, ever-changing regulatory environments at the federal, state, and local level. That was what I did as a lawyer, and that is what has always inspired me to not only seek public office and to shape public policy, but to be mindful of the fact that health care is a fundamental right. It is a right bestowed upon all of us, and it is a right that all of us must not only cherish, but demand for every single person in this country. I'm a proud husband of a physician. My wife, Christina, is a rehabilitation doctor, physiatrist at the Rehabilitation Institute of Chicago. And I feel like I've gotten an honorary medical degree just being at her side throughout her medical training and as she goes to work each and every day and we share stories at night. When I first met Christina, she was just entertaining the idea of going to medical school. She had been a psychology major in college and chose to pursue her medical career, so she had to go back and take pre-med courses, then take the MCATs, then get into med school, then 4 years of med school, then residency. And I was there along the ride the whole time, and I can tell you this. I went to law school. I'm almost embarrassed at how easy law school is compared to medical school. And I have the utmost respect for those who are in our healthcare profession, those who care for our most vulnerable, the sick among us, and those who need care both medically, psychologically, and otherwise. My wife, Christina, and I have nightly conversations, as any couple would, about how our healthcare system is working or not working, how her day in and day out job affects her whole outlook on life. People who are disadvantaged, people who have been given chronic, lifelong health conditions that impair their ability to not only live a quality life in a painless way, but achieve their own dreams. The Rehabilitation Institute is a miraculous place, and I feel very fortunate, and Christina feels very fortunate to be a part of it. And it is her stories, her commitment, that drives me further in terms of what I do as Comptroller. And I'm proud of what I've done as Comptroller. I'm known for my work in making sure that the state has a responsible budget. I've been a long advocate and a long critic of the bad budgeting practices of previous governors that have led us to the financial crisis we're in today. But my criticism and my absolute obsession with financial responsibility is not because I just want to make sure the budget balances and the numbers all work out. It's because I know the consequences of bad budgeting. The consequences of a bad and broken healthcare system. A healthcare system that is supposed to be providing care to those who need public health care, but that care is not being delivered or is not quality because of an underfunded system that we have. Underfunded by billions of dollars. Providers who are waiting months to be paid. Providers who are leaving the program because they can't afford to take care of Medicaid patients, because they can't run their own businesses while taking substandard reimbursements and waiting nearly a year to get paid. A broken healthcare system because of irresponsible budgeting and, frankly, a lack of compassion for those who depend on public health care. This is what the state's challenge is. We must fix our broken healthcare system. I'm also somebody who is passionate about stem cell research. When George Bush cut off funding for stem cell research at the federal level, I took up the battle here in the state of Illinois and led the fight for public funding of stem cell research right here in Illinois. We have been leading in this coalition, and now, fortunately, with President Obama, stem cell research funding is continuing again at the federal level where it belongs. But the state can continue to make those investments and try to make Illinois a center for stem cell research, both for benevolent and humanitarian and research purposes, but also economic development purposes. We need to become the center in the Midwest, if not nationally or globally, for stem cell research. As your next governor, I will take these commitments. I will take that passion for health care and make sure that we work with our federal government, because right now all eyes are in Washington, demanding, hoping, praying for a universal health care, for a quality health care system for every person in this country. And we wait, and we fight, and we work together to make sure that Congress follows through on that commitment, and the President signs it into law. And that is when the state of Illinois will join in partnership with the federal government to implement that program and to make sure that it works as intended, and that we make good on that promise that every person is entitled to affordable, quality health care. As your governor, that will be my commitment each and every day, agency by agency, budget line by budget line. I will make sure that we balance the budget and we don't borrow from our providers. I will make sure that we implement the federal health care plan and that the state is a true partner in that effort. And I will make sure that the state of Illinois is as good as the people who live here. Thank you very much.
Well, thank you very much. It's an honor to be here with the Campaign for Better Health Care. I've been at previous gatherings. I believe in organizing. That's the only way we can win victories at the federal and state level, at the local level. I was with my doctor, Quentin Young, 8 years ago, and we believed in organizing, and we started on the Mississippi River at Rock Island, the Centennial Bridge, and we walked across Illinois on behalf of decent health care for everybody. And we met many people along the way who are helping us today on this battle. The federal issues are very, very important. We want to win the federal health care reform and keep on working. Actually, when we did that walk across Illinois from the Mississippi River to Lake Michigan, the sponsor of our proposal was a fellow by the name of Barack Obama, who was a state senator at the time, and Now he's President of the United States. And I hope we can work together in the next few weeks to win a landmark victory for our country and for our state. And as Governor of Illinois, I've already said that if the reforms are passed, we will not opt out of the fundamental reforms that we need in our country. We want everybody in, and we want nobody left out when it comes to decent health care for everybody. I was part of the effort that got the All Kids program adopted in our state. I think that was a good reform. It made sure that a lot of children who didn't have health insurance got health insurance, and I worked for that, and I worked with you on that. Very important thing for our country, to do the same thing for all children. I also believe in all veterans. It's shameful in our state and our country that there are veterans who don't have health care, affordable health insurance. Even if they've served, if they don't have a service-connected injury, there are literally thousands and thousands, tens of thousands of veterans across the United States who don't have affordable health insurance. I started a program in Illinois called All Veterans to make sure our veterans are included with health insurance. As a matter of fact, we have a scratch-off lottery ticket called Stars and Stripes. I've been promoting that this whole month. Some of the proceeds of that program are used to provide health care to our veterans, especially in the area of those veterans who suffer from post-traumatic stress disorder, which is the signature injury of this war. In a lot of ways, there are many citizens in Illinois, whether they be civilians or veterans, who suffer from mental illness, and I've always been an advocate of fighting hard for those who are entitled to mental health care. And I had to do that this past summer. As you know, the General Assembly, in its original cut at the budget, cut human services by 50%, including many things that are important in health care. And I thought that was the wrong way to go, even in a tough economic time. I vetoed that budget on about the 1st of July. We had to have a extra session there to get that repaired, and we did get it repaired. We got the money for human services and health care, and especially that for veterans and post-traumatic health counseling. We got that taken care of, and that's what governors do. I am the governor of Illinois. The fellow running against me wants to be governor, but I've been governor for 9 months, and I think I've had a good track record of fighting for health care on all fronts. I can remember very early in my administration, I signed a bill to make sure that all women of all backgrounds, no matter what their income, particularly those who are women of color, have an access to breast cancer screening and mammograms. I think it's exceptionally important. I believe in public health. If you've had Dr. Quentin Young as your doctor, as I have for more than 20 years, you know all about public health. Public health is the key to making sure we're protected against many illnesses, including H1N1. And I was out there in the front line with our public health director earlier this year. We're out there right now making sure our people are safe, and we have to work together on that. But I understand that public health and investing in public health is the key to life expectancy in our country. And I want to make sure that our Department of Public Health works with everybody here so we have everybody in and nobody left out. Thank you very much.
All right, gentlemen. As Jim Duffett said, Senator Harry Reid is just proposing today the Senate version of the health care reform bill. But let me ask you, if you were a member of Congress, would you have supported the House proposal that recently passed that included the employer mandate, a public option, and a restriction on federal subsidies being used for private plans that offer abortion services? Governor? Why don't you just sit?
Okay. Well, I think that no bill is perfect. I happen to believe in universal health care. I believe in a system of single payer. I have all my life. Cardinal Bernardine, when he was alive, and he passed away in November 13 years ago, just before he died, he wrote a pastoral letter urging all of us to work for that very same thing. Well, we're not going to have it right this moment, so we have to get as far as we can down the road. That's how I see the federal health care reform. The bill passed the House. To me, it's great progress. I hope we can get as much of the House bill as possible. I know there are compromises in order to get votes. Sometimes you have to do that in the legislature of Illinois or the federal Congress. But I'd much rather see progress, our president making some real significant gains for the American people in their health care than coming home empty. So I would support the the bill of the House. I don't know what the Senate's going to do. If they water it down, I certainly hope that Conference Committee will stand for the fundamental principles that we all agree on.
Comptroller Hynes?
I would have voted against the Stupak amendment, but voted for the bill. It's unfortunate that amendment was entered into it, in my opinion, purely for political reasons and as a way to drive a wedge into the debate to pull off votes from an important piece of legislation. But as was mentioned, it's not a perfect piece of legislation, but it is important that we move it forward. We need to fight in the Senate to not only remove that provision, but to continue to improve the bill and demand that it stays true to its core principles, and through the Conference Committee as well. Universal health care is our goal. This bill is a major step forward, and I applaud the Obama administration. I applaud the U.S. House of Representatives for moving it forward, and I stand ready to help.
Right now, the public option applies only to those individuals who don't have health care and a phase-in of small businesses. As governor, would you support legislation that would allow all Illinois residents to have the option of choosing a public or private plan? Comptroller Hynes, let's start with you this time.
Sure, I would. I believe, obviously, a lot of this has to do with what comes out of Congress. So, you know, there's going to be, I think, a lot of hypotheticals, and I wouldn't want to call it conjecture, but we're going to be speculating a little bit about how it comes out of Congress. But I think that, number one, I would agree that we should not opt out. We should have, Illinois will remain true to the public option, and then we need to implement that so that every person in Illinois has that option and has an option for the public health plan. So yes.
Any disagreement, Governor?
No, I think we need to include everybody in. That's the only way to really have an insurance plan. You have to have everybody included and nobody left out. That's how you can best manage the risk. We've tried in Illinois, as everyone knows, to include all children. I think that was progress. Same way with veterans. That's very important. I think young adults. That's one of probably the most underinsured group in America, and we hopefully can make some progress there. So I think our state can be ahead of the federal government. In a lot of ways, we're going to get to the universal health care that I look forward to by only having states lead the way, and so I hope Illinois can be a real leader.
You both mentioned single payer. Do you think, if there's any possibility that the federal bill would allow for a single payer system, would you opt for a single payer system here in Illinois?
Well, I've always favored that. I think that's the only way to really do an insurance plan. Our friends in Canada, it began in the provinces. It then became the national system of health care in Canada. It's called Medicare. We already have universal health insurance right now for everybody if you're over 65. I think that the progress made at the federal level this year will set the table, and I think the President sees it the same way, for a true universal system. Ultimately, I think we will have a single-payer system. In my opinion, the sooner the better.
Our goal has to be universal health care, and because the federal government is moving, fortunately, forward towards that goal, the state of Illinois needs to conform around that plan once it's finalized and it's implemented through the states. That means that we have to, implement it both in terms of how the expansion of Medicaid program is formed, working through the co-ops, working through the public health option, making sure that we have our Department of Insurance implementing all the insurance reforms. But what we have to do is, if we find through implementation that there are people who are, for whatever reason, falling through the cracks, not being able to access one component, one avenue or another in the national framework, then we have to cover that at the state. Because we have to have universal health care, and the federal government's role and the federal government's actions are going to provide the framework for it. We won't know until it's already implemented whether it's a perfect system, but the state will be able to take advantage of that system to perfect it in Illinois, and that will be my commitment as governor.
So to the state's condition right now in terms of health care, what will you do to move Illinois out of its deadbeat status as it faces $1.5 billion in unpaid bills to health care providers? Governor?
Well, I propose something that other governors have been afraid to propose, and I think other statewide officials have been afraid to embrace. We need to use the income tax as a source of revenue to help pay our bills. I said this on March 18th. I propose a tax reform that actually reduces taxes on millions of Illinois citizens. We would use the personal exemption and earning income tax credits and some property tax relief to get a real tax reform plan. But we have to use the income tax, the tax based on ability to pay, in order to get Illinois the revenue needed to pay its bills so we can pay our hospitals and our nursing homes, our doctors, and other health care providers. I think it took some courage to do that. I still believe in that. I'm not backing down on that. In a lot of ways, February 2nd is a referendum on that, because my opponent has chosen to demonize the income tax, demonize me. He doesn't talk about our whole plan. He doesn't talk about any of the tax relief. And I think it's not a good way to go. I think Illinois needs to face up to the fact that our state for years and years has had a structural deficit. That's why the health care bills have been not paid. I'm the governor who wants to be level with the people, honest with the people. We've got to make sure we have an honest government and an honest governor. And I think the results on February 2nd will go my way, because the people of Illinois want to make sure we have a state that pays its bills and moves forward to the future.
Governor, how much do you propose raising the income tax to fund health care?
No, I propose raising the income tax rate from 3% on individuals to 4.5%, but it also included a very generous personal exemption. My opponent over here never talks about that. $6,000 a person, personal exemption. That means for a family of four, it's $24,000. If you made $60,000 or less as a family of four, you would pay no higher income tax, and every family below that of four would pay less income tax. We'd be reforming the system. That's what we need to do. We have one of the most unfair tax codes in the country. He's going to talk about having a progressive income tax. I believe in that. I believed in it for 30 years. I put it on the ballot in 2004. People voted for it. I voted for it. He voted against it. 77% of the people of Illinois agreed with my proposal then. I've been for it ever since. In the legislature, it was proposed in 2008. I supported it then. He wasn't there. I think it's very important to understand that in order to get a progressive income tax, an income tax rate higher on those who make over the $250,000 a year, you need a constitutional amendment. You can't just wave a wand and get a statute passed. You need 3/5 of the House, 3/5 of the Senate, and then a referendum of the people on November 2nd of next year would have to vote for such an amendment. Now, I've been for that for a long time, but we've got to do things now to get Illinois stabilized now. And so it's not a plan to just talk about something in the future if we have real problems today.
Comptroller Hynes, what are your plans to raise revenues in order to support health care, among other things, in Illinois?
Well, first, I think those were two questions strung together, so can I have additional time to rebut the 10 or so accusations made in that last response?
This will add to your time. Yeah.
Okay.
All right. We'll add a minute to your 3 minutes.
Thank you.
Okay.
Because there's a lot to counter here. So many distortions, so little time. Governor, I've talked about your tax proposal, and I'm glad that we're both talking about more money for the state, because there's no doubt about it, we need more money for the state. I have proposed an income tax increase, but a graduated income tax increase. But the fact that you had 3 different proposals leads people to be confused about what exactly your plan is. So I don't think it's our fault that we don't understand exactly what you're proposing, because you embraced 3 different proposals. The progressive income tax is the way to go. We're talking about health care for those who can't afford it, those who can't access it. We're basically talking about the low-income, middle-income families. I don't think it's sensible at the same time to raise their taxes by 50% during a recession, especially when there are alternatives. We want to raise the cigarette tax by $1. That would pay off $3 billion in health care bills if we leverage it. There will be a way to do that, as well as other revenues now, progressive income tax in the future. I did oppose a tax increase in 2003. But this is a time of crisis. We have a lot of bad options, and I believe the best option is the progressive income tax. Now, you talk about an honest approach. I don't know how honest it is to sign a budget and declare mission accomplished when it is unraveling and we have $4 billion in bills we can't pay right now, many of them to health care providers. This is not a responsible budget. This is not even close to a responsible budget. And I think we need to deal with it now. As you said, deal with it now. We need to bring some solutions to the table now, not wait till after the primary election, which is what you said. No more talk about the budget, no more talk about taxes until after the election. I think we've had enough political expediency and election-based decision-making. We need real solutions now. That's what my plan offers. Real solutions, progressive approaches to taxation, and responsible budgeting, which is what I've been advocating for 11 years.
Comptroller Hynes, do you have a plan to raise revenue other than the progressive income tax, which would take
Yes.
action by the legislature?
Yes, we would raise over $3 billion in revenues through a $1 increase in the cigarette tax, and by leveraging that, we could pay off $3 billion in health care bills. Closing corporate loopholes, expanding the sales tax base to include luxury service items, increasing the taxation rate on casinos. These and other items would bring in billions of dollars into the state now and allow us to reduce the deficit and then put on the ballot an amendment to a proposal to amend the Constitution for a progressive income tax. I keep hearing that it would take too long and it would be too hard. Now is the time. If we believe in the progressive income tax, now is the time. Because if we pass a flat income tax and make our flat income tax even more regressive, we're never going to get to a progressive income tax. It is now that we should embrace this idea. Bring tax revenues in now through other forms, reduce the deficit, and then work together on something I believe we all support, which is a progressive income tax. One of only 7 states in the country that has a flat income tax. This is the way we should balance our budget. It makes economic sense because we're not raising income taxes on the middle class during a recession. It makes budgetary sense because it allows us to pay down a deficit over time that took us decades to get into. And it has a short-term and long-term approach. This is the best solution for our budget crisis, and it means better health care.
Governor Quinn, I'm going to give you one more crack at that. The progressive income tax or the tax hikes that you've proposed with the personal exemptions?
I'm the one in 2003 put on the ballot in 2004 a referendum that the people of Illinois voted on overwhelmingly, called the Taxpayer Action Amendment, to have a progressive income tax, to use that money to help stabilize our budget. My opponent was running for U.S. Senate. He said he was against it. He voted against it.
Okay, but that was then and this is now. So what are your positions
I've
now?
been for that amendment ever since. Mike Smith, a representative from Canton, has put it into the legislature. It was voted on last year in 2008, in 2008, and I'm still for it. We're going to try and get a vote on it this year. I do want to say one thing. In my budget, on the 18th of March, we put in a cigarette tax. It passed the Senate. It's pending in the House. He didn't help at all. We also put in closing corporate loopholes. I've been for that since NOAA. I believe in closing corporate loopholes, and I was the commissioner of the Cook County Board of Tax Appeals when I was talking about that. This is not a newfound faith for me. But the bottom line is an independent group, the Institute for Taxation and Economic Policy, has found that the Comptroller's plan, if you want to call it that, is $3 to $4 billion short. It sounds good if you say it fast. Unfortunately, it doesn't balance out. I've got to deal with reality today. And at the last few weeks of the General Assembly in October, we were able to get more money from the General Assembly to leverage in Washington to get over $1 billion more for Medicaid funding for Illinois. That's what governance is all about. Managing the budget, working with legislators. I can't just wave a magic wand. No governor can. You've got to work with the legislature to get tax reform, tax relief, revenue to carve down the deficit. But I was there fighting for this. The Comptroller was not. He didn't participate in the debates, and I did. And I think we've done pretty darn well under the circumstances of stabilizing our state budget. We have a long way to go, but when they were trying to cut post-traumatic stress disorder counseling for our veterans and other people in Illinois, the Comptroller wasn't there. I was there fighting for those people. I think that's what you want in a governor.
Continuing on the question of revenue, how we bring in more revenue into the state. Right now, because of the stimulus money, 65% of Medicaid, they're paying Medicaid up to 65%. When the stimulus money runs out in December of 2010, it could go back to the federal government only paying 50% of Medicaid claims. What will you do at that point? Comptroller?
I think we should push to have the federal government make the higher reimbursement rate permanent, and it's a perfect time to do it because of the national health care reform debate that's going on. But I want to address a couple of things that the governor said. He says we need to deal with reality today. How does saying we're not going to deal with the budget till after the primary election deal with this reality today, which is what you said? Our budget is spiraling out of control. $4 billion in bills we can't pay right now, and you want to wait till after the election to deal with it. Secondly, you've talked about who was involved and who was not. For 11 years, I took on George Ryan, Rob Blagojevich, these bad budgeting practices that have gotten us to the point where we are now. It was not easy to take on Rob Blagojevich in his first term in office as a Democrat, because many Democrats were saying we need to be loyal to our governor. He's our governor. But I stood up. I spoke out against his abusive spending. I stopped the payment for illegal importation of flu vaccines. I called out his budgetary gimmicks. Others stood silent. Others stood by their running mates and were applauding those efforts. There's a difference. And it doesn't make him a bad person. It just speaks to leadership. We need people who are going to stand up, not when it's convenient, but when it's needed. On the sidelines, 11 years I've been fighting for budget reform, including when our new governor took over. I gave him his first budget address when he didn't have a budget team of his own. I gave him ideas on how to bring more revenue into the state, identified ways to cut costs. And now, I'm managing the crisis that he can't solve. Every day, thousands of people calling our office, healthcare providers, social service providers, desperate because they could barely keep their doors open, because we're going to wait till after the primary election to deal with this budget crisis. That's not dealing with reality today.
All right, let's get back to health care a little bit more tightly here. In terms of, we've talked about the revenue. What about cuts? Is it necessary, in order to balance this budget, to cut some of the health programs for the poor, and which ones would you now cut? Governor?
Well, I've tried to fight as hard as I can to not have cuts on people who are vulnerable. I think I did that in the battle for the budget this year. It wasn't easy. General Assembly wanted to cut 50%. Great programs of human service and health care for people with disabilities, for seniors, for children. I wouldn't let them do it. I vetoed it. I didn't have any support from a constitutional officer who was supposed to be the chief fiscal officer. He wasn't around. But I had to do it. And we worked together with community people all across Illinois. And we put together a movement. And basically, we won the day. We stopped the 50% cuts. We had to have some cuts. It was maybe 14, 15%. They were no fun to do. But it had to be done given the worst fiscal calamity Illinois has ever had. I didn't create the budget deficit. I got sworn in on the 29th of January. I inherited it. I don't think anybody in this whole country would say that we had an easy time of it. We had a very difficult time. The former governor was impeached and removed from office. My friend, the Comptroller, he voted for him. He endorsed him in 2006. The man went haywire, and obviously the people of Illinois weren't happy about it. I led the effort to get recall in Illinois on our Constitution. In 2008, it would have been on the ballot, but Rod Blagojevich and Dan Hynes worked against recall. They couldn't do it again this year because we put recall on the ballot in 2010 for the people of Illinois to vote on, to put it part of our Constitution. So if we have a governor who goes on the wrong track, betrays the public trust, we can do something about it as voters. And I think it's important to have a governor who stands up for ethics and honesty every day, tries to do the very best you can for our economy, because the key to getting more money for human services and health care is having a strong economy. We want to do that. And I'm the governor who I think has the best experience at getting jobs and economic growth. I've been the state treasurer, been lieutenant governor. We worked a lot on the green economy and green jobs. And now I'm the governor. We've worked very much on getting economic development and getting a jobs bill passed into law. It was the first time in 10 years we got a capital bill passed. So I think these things count. Ultimately, we'll just finish here. I know we want to go on. But ultimately, the only way we're going to have a better budget is we have to have a stronger economy, more jobs. Everybody in this room, we know that. And if we're going to have good health care, we've got to have a strong economy.
Comptroller Hynes, can you make a pledge now as far as what kind of cuts you would or would not make
Sure.
in terms of health care for the poor?
I'll go further than that. My budget plan that is on my website identifies $1.6 billion in cuts that can be made without harming human services, without laying off frontline workers, without hurting middle-class families. $600 million in bureaucratic cuts by causing calling agencies to reduce their operating lines to 2005 levels. There's another example I think is very illustrative in this setting. We want to cut $300 million in discretionary contracts, legal contracts, advertising contracts, consulting contracts. Why are we spending $27 million in advertising of the lottery at the same time we're cutting human services? $30 million in cuts to the developmentally disabled. Why are we spending $27 million advertising the lottery? I think we all know we have a lottery. And most of the advertising is intended for people who probably shouldn't be paying the lottery anyway. We should be prioritizing. It's not just about cutting. Now, one element of the governor's cuts is the budgetary sleight of hand that got us into the problem we're in right now. Over $1 billion in health care bills that weren't really cut, they were just moved from one fiscal year to the next. This is that abusive practice of delaying payments to our health care providers. We're doing pretty well because of the stimulus package with Medicaid providers, hospitals, and doctors. But group health insurance, state employees' health insurance payments are exploding in terms of length of delays. There's something wrong in the state of Illinois when the comptroller's wife gets a collection notice from her physician because the state hasn't paid them on time. That's how broken our healthcare system is. My wife, a doctor, gets a collection notice from her doctor because she went to her healthcare provider under the Cigna plan and they haven't gotten paid. That's how broken our healthcare system, and it's because we aren't balancing the budget and we're using budgetary sleight of hand instead of making tough decisions.
So what, Governor, would you plan to do specifically about the time delay right now in paying medical providers?
Well, I think it's important to point out that if you're a doctor providing Medicaid, a hospital, nursing homes, they're getting paid within 30 days. That's part of the federal law. We are getting enhanced reimbursement from the federal government. We made changes already in Illinois in October to get even more money under our Medicaid enhancement opportunities. We can use that money to help pay down the debt. With respect to the state employees, that's a serious problem. I have no questions about it. The General Assembly, when we adopted the budget, we have to come back. When he talks about when to do it, well, the vote requirement to get any revenue right now is 3/5 of both houses. Well, there's a lot of Republicans there that won't vote for any kind of revenue whatsoever, and there's some Democrats, unfortunately, like that. So we have to wait until the majority requirement is a simple majority. That's after January 1st. That's what our Constitution says. We have to deal with reality. Back when we had a simple majority in April, May, and June, or it was actually March, April, May, that was a chance to get revenue and reform the Illinois tax structure. I proposed a reform. Fundamental reform. It would have cut taxes on modest income people and poor people. Families of four under $60,000 would have had a lower tax burden. But a lot of people, like the Comptroller, wouldn't go forward and support it then. He talks about unpaid health care bills. I'm concerned about that. Everybody is. But when the chance was there to get revenue in the spring of this year, he wasn't there. I was there. I was advocating for this, and we're going to win this. We're going to win it in the new year, and I think it's important to have a governor who goes to the ballot on the 2nd of February with an honest message that we're going to use the statutory process of Illinois, which can be done right now, to make sure we pay our bills. And that's the only way to go. If you say, well, we'll get a constitutional amendment sometime down the road, that doesn't get those health care bills of the Comptroller's wife or anybody else paid sooner. We need to make sure we do it right and do it in the new year.
Governor, the new legislature will convene January 1st. That's before the primary, or January.
No, it's
the beginning of January.
Yeah,
what I'm saying is, will you propose new tax issues, new ways to raise revenue before the primary?
Well, I already proposed it. It's there. I have a plan that I think is a very fair plan. It does raise the income tax rate on individuals.
You asked for a vote on that before the primaries.
I already have asked for that repeatedly. I think it's important to always remember that our plan, our tax reform plan, also has more generous personal exemptions. That's a key way, it's an American way for years and years to lessen the tax burden on ordinary people who are making modest incomes and who are very poor in some cases. That's the fair way to describe my plan. The Comptroller chooses not to do that, but basically we can cut taxes on many people if we use a fair tax reform. Illinois has one of the most regressive tax codes in the country. I'm trying to change that. I think that's good for health care because we don't want ordinary everyday people who live from check to check paying unfair tax burdens. And I think the plan I proposed, the plan I still support, the plan they could vote on after the 1st of January is one that would help solve our revenue problem, reform our tax system and make it fair, and move Illinois forward.
Comptroller, should we now, because we're in such a mess in terms of our finances, borrow to pay down Medicaid bills?
We've already borrowed $2.2 billion, and yet we still have $4 billion in bills in the Comptroller's office that we're unable to pay on a daily basis, which is why payment delays have gone to extensive amounts for our providers who are not covered under the stimulus package. And as I mentioned before, these are not just accounting problems, and they're not just problems for providers. When providers don't get paid, providers leave the Medicaid program. We conducted a study recently. 4,000 respondents of people who are in the Medicaid program, 70% saying they're having trouble finding a doctor. We had hearings all over the state from people who came and cried and told their stories about the fact that they have to drive 100 miles to get to see a doctor or wait months to get to see a specialist for their child or for themselves. This is a broken healthcare system that is having a real impact on people. We've got to deal with it, not only because it's responsible budgetarily, because it's the humanitarian thing to do, and it means living up to our promises. Thousands of people who are desperate to get paid by the state. Tens of thousands, perhaps, that are having trouble accessing health care or who are not sure whether they're going to be able to stay with the doctor they have right now.
Comptroller, I don't think anyone would disagree. The question is how.
Right. Well, our plan would bring in a $1 increase in the cigarette tax. We'll pay off $3 billion in health care bills if we leverage it and use the federal stimulus monies. And in terms of borrowing, there was a $3.5 billion borrowing program to pay our pensions that we have yet to execute. If we were to just execute that borrowing from the pension obligations, that would free up close to $1 billion that we could help pay down these health care bills. Just if we follow through on a borrowing that was already authorized. So we've borrowed $2.2 billion in short-term borrowing to pay down the bills, and yet we have $4 billion left. And then we borrowed $3.5 billion to skip out on a pension payment that we were supposed to make, but we haven't gone through with that. So it's actually causing great stress on our cash flow. If we would just follow through on that borrowing that's already been approved, it would help our cash flow, and that's what we need to do.
Governor, do we need to do that?
Well, on the cigarette tax, I just want to point out that I do believe that we should raise the price of cigarettes through a cigarette tax. I supported that. It's already passed the Senate. It's pending in the House. I'm working on that. It was in my original budget. I think one of the best things about that is young people won't start smoking if you raise the price of cigarettes. And this is a very important issue, public health issue in Illinois. And I believe in public health. I think we need to, obviously at this time, be very much on our toes about H1N1. And I took the L to work one day because our vice president was saying don't take the airplane, don't take mass transit, and trying to allay public fears about H1N1 back in the spring. I think you need a governor who gets down and works hard on these issues. You can't just say do this and do that. You've got to work with legislators who come from all parts of Illinois who have different points of view to get things done. That's what I've done. Ever since I got sworn in on the 29th of January, when I got there, people weren't talking to each other. People in their own party weren't talking to each other. We've calmed that down. We bring people together. We've gotten a lot of bills passed. One of them I want to talk about, which is House Bill 3923. This organization helped lead the charge. It's going to allow consumers an independent appeal right to to a neutral third party if there is an insurance denial of care. This is a fundamental reform in health care in our state. It says that if you're told by an insurance company they're not going to cover something, you have a place to go that's independent. And I think this is a great reform. We're going to be signing the bill. I hope Campaign for Better Health Care is there with us, because you sure helped pass that bill. And I think that's the kind of steady... Thank you. That's the kind of steady progress we need in Illinois. We need a governor who can work with the legislature, push them along, get things done. I think this is one of the best years ever in getting reforms enacted. I want to make next year even a better year. And I know how to do things on reform. I'm a grassroots organizer, and I think that's what this group is, and all of us have to be if we believe in the power of democracy.
Gentlemen, right now federal legislation will not allow undocumented residents to participate in the exchange program, even if they were to pay 100% of their coverage. Do you agree with this? And if this remains in the law, what would you do at the state level to facilitate insurance and health care access for the undocumented? Comptroller?
As I mentioned, I support the bill that's currently in the Congress as it's written, and I think that we need to move forward on that. Once we get it into place, we can work on efforts to expand it with respect to children of undocumented immigrants and those who are in need of health care. But I think we need to stick with the plan that the federal government is currently working on.
But would you do anything at the state level? Say it's not in the final plan. Would you do anything at the state level to provide access to health care for the undocumented?
I would first have to see how it's implemented and what the costs were to the state to make sure we can afford expanding it. And so I would have to first wait. I'm not going to commit to that yet until I see how the plan is actually finalized and implemented at the state level.
You're not going to commit to it, but philosophically, do you oppose it or support it?
Well, again, I mean, it's a question of cost, and it's also a question of what we can practically get accomplished, given the fact that we're in a fiscal crisis of $10 billion. And so that's my position. I'm not ready to commit to that.
Governor?
Well, I think we have to understand that public health means everybody in our society. So, we have to take a look at that. I certainly wouldn't want a pandemic to occur in our state or anywhere else if we fail to take reasonable steps. Now, having said that, I do support the federal bill with all of its compromises. I don't, as I said earlier, I happen to believe in a single-payer system for national health care. I think we eventually are going to have that in our country. I think maybe some states are going to lead the way with respect to those who are not citizens, who are undocumented. I think that at the outset, we're not going to be able to include them in a federal plan or a state plan. But I do think we have to keep this in mind, that whoever is in our society, if they get sick, they can get a lot of other people sick. So we have to listen to our medical professionals and protect the public health, whatever it takes.
But again, the same question. Philosophically, are you, where do you stand on including the undocumented?
I think if you look at it philosophically, I think health care is a fundamental human right, wherever you believe.
So do you see a way to apply that?
But I'd say with respect to our country and our state, we're trying to move the ball forward. And I think if, at this time in the federal bill, it's not included for undocumented. I don't think it will be eventually in the federal bill that's passed by the Congress, signed by the President. I think here in Illinois, given our fiscal challenges, we've got to get them under control. And I don't think we're going to have ambitious plans that go beyond the citizens of Illinois.
I'm pretty sure our answers are the same.
I believe they are, too.
Okay.
The House Health Care Reform Bill contains a provision that allows states to immediately extend Medicaid coverage to non-disabled people with HIV. If this is in the final health care reform bill, would you support Illinois taking advantage of this program? They're trying to use it as a Medicaid expansion as a pilot program. That's what I'm looking for. We're trying to use it as a pilot program. If this remains in the legislation, would you like Illinois to be part of the pilot program in terms of looking at ways to expand Medicaid coverage, particularly for those with HIV?
Well,
Comptroller, let me start with you this time.
Sure. I believe that we could be a part of the pilot program. It's something I do support. we have to continue fighting at the federal level to make sure that that it remains as part of it, and that the state of Illinois is part of a partnership with the federal government on that and many other issues. But yes.
Governor?
Well, I certainly think so. I would hope so, and I would hope this remains in the federal bill. We already have in our budget, even with all the troubles we have, a significant investment in HIV prevention and helping those afflicted with HIV and AIDS. Matter of fact, in our capital bill, we have things in there that will help as well. I believe that, as I said earlier, public health is the key to longer life expectancy for Americans and Illinoisans, and I believe in it. And I think you never have had a governor in the history of Illinois who's more committed to public health. I did it with my feet, with my doctor. Anybody who walked across Illinois with Quentin Young, Dr. Quentin Young, the doctor of Martin Luther King Jr. when he lived here in Illinois, 1966. I got the gospel from Quentin Young, and I'm going to carry that forward across Illinois. So we do have good public health, decent health care for everybody. He's an advisor of mine. He doesn't even pay $1 a year. He's just an advisor of mine, and I take his advice very seriously.
Try living with one.
Okay.
Now, this is a question from the Campaign for Better Healthcare. As we look at how we're going to implement healthcare reform in the states, would you support the reconvening of the Healthcare Justice Act's Adequate Healthcare Task Force, which did play a major role in healthcare reform over the last 4 or 5 years? Would you support a reconvening of that Adequate Healthcare Task Force to play a major oversight and recommendation role as we implement health care in Illinois? Governor?
I think it's a good idea. I was involved in getting it passed in the first place. I just never liked the name adequate health care. I thought it should be the decent health care. That has a moral dimension. That's what Cardinal Bernardine talked about, that it's incumbent upon all of us to live out social justice, that health care is a fundamental right. And so I do believe in the opportunity of having a state task force. I probably have a different name than adequate. It would be the decent health care for everyone, everybody in, nobody left out task force. That's a mouthful. But I think that's the way that we are going to take what happens at the federal level and move the ball forward in the land of Lincoln. We can be the leaders. That's how it really happened in the laboratories of democracy. States have to be leaders, and I want to make sure our state is a health care leader all the time.
Comptroller, how would you build on what the Healthcare Task Force has done over the last years if you did want to reconstitute it?
Well, first, I'm going to call it the healthcare is a right, not a luxury, especially when it comes to people who can't afford it, and therefore we have to make sure it's universal task force. I'm just kidding. I don't mean to make light of it.
We'll have a nice time putting that on as super on our news broadcast.
No, I do think that we are going to need a task force. We're going to need a consortium of experts to help implement this federal legislation, because it is multifaceted. It has many impacts on the state budget, on the state regulatory system, on interagency workings, and it's going to take a great deal of deliberation and effort and consultation with experts from the healthcare field and from this organization and many others. There is no doubt about it, and I'm looking forward to, as governor, convening that and making sure that we implement the federal plan and if possible, improve upon it here in Illinois.
All right, Comptroller, I'm going to have you start with your closing statements.
Thank you again for allowing me to be here. I want to just talk about, we've talked a lot about policies and details, and I just want to talk about something personal to me that I actually was just reminded of when Midge was telling her tragic story and heart-wrenching story, and that is that there are those moments in life when you realize how lucky you are to live in this country, and how lucky I may be and others may not be to have health care that is affordable and is quality, and it renews your commitment to make sure that everybody has the same quality health care, the same access to health care and health care insurance. My wife had difficult pregnancies. She was almost gave prematurely to our son Charlie, and then the twins Liam and Finley were born premature. And I will never forget being in the delivery room when the twins came and Finley was the second born and he wasn't breathing. And I remember a team of nurses and doctors whisking him away and working on him. And I remember how scared I was and how, in a moment, the greatest joy, the most joyous moment of your life was turned into the most frightening moment of your life. Fortunately, he was given great care, and he pulled through. He was in the NICU for about 10 days. And every day we would go to the NICU and visit Liam and Finley. And I would see these wonderful nurses who would care for my child like it was their own. And I would see these doctors, these neonatal intensive care, neonatalists, neonatologists who would care for my twins and give me comfort and let me know what was happening so that I was not as frightened as I could have been. And it was then that I realized how lucky I am to have good health care. It was then that I realized that it has to be anybody who's in a position to make a difference or anybody who just has time to join a cause, like all of you, to demand universal health care for the people, for every person in this country, every person who deserves it, and every person who is afraid of losing it. We have the greatest country in the world, the wealthiest society that we're very lucky to live in. And it is just absolutely unacceptable that we can accept anything less than everybody being treated equally. This is my commitment as governor. I will fight to make sure that the federal plan is implemented fairly and making sure that it is effectively implemented and expanding it where needed to make sure we make good on that promise of health care for all. That has been your commitment. That has been your passion. I believe I live this every day in more of an administrative role in terms of fighting for a well-funded Medicaid system, in terms of fighting for stem cell research, in talking to people who are falling through the cracks of our broken healthcare system, people who are going to try to see doctors with a public health care card, but they can't get in to see that doctor, providers who want to take care of their patients, but can't afford to do it because they're running a business, they're trying to provide for their families. Our system is broken. Our budget is broken. And it affects all of us. That is why we believe in universal health care. That is why we believe in democracy for all. That is why this organization was founded, and I look forward to working in partnership with you as the next governor of Illinois. Thank you.
There you go. Well, the previous speaker wants to be governor. I am the governor, and I have worked every day in the 9 months I've been governor for decent health care. And I think you really have to look at one's record more than any other way when you judge the candidates on February 2nd. This is a historic election. I happen to believe we need to use the progressive income tax in order to fund basic human services like health care, like education, like taking care of people who are very vulnerable. I've stood for that. I stood in the well of the House and told the House and Senate that. There are other elected officials at the statewide level that duck that issue. And I think when you talk about adequate funding, we need a statute. We need to make it sure that it's done in a fair way that produces tax relief for people who need it the most. We got to have adequate revenue to pay our bills in Illinois. And we have to have a plan that's a real plan. And that's what I've done as governor. Almost from the outset, I've been signing bills to make them law that are really important bills in Illinois. Having mammograms and screening for every person, no matter what their color, no matter what their income, that's a real reform. I helped get that done. I also worked with this organization and many other good people on insurance reform. We can't have these insurance companies denying care to good people. When they get sick, they're denied care. We have to take them on. And we have passed a bill that will shortly be signed into law, thanks to the efforts of the Campaign for Better Health Care, that will really make a difference for ordinary health care consumers all over this state. I was involved in that battle. Our director of insurance led the battle. You've got to have good people in government. You have to have people in the Department of Public Health that work when we have a potential pandemic. Something like H1N1, kind of scary. You got to have a governor and a health care department, public health department, that helps the people of Illinois get what they need to fight back and make sure we're healthy and safe. I understand the whole battle for decent health care, universal health care. I walked it. I spent 15 days in August of 2001 with one of our nation's leading advocates of decent health care, Dr. Quentin Young. I've never, ever wavered from that. I think it's important to have a governor who can be a national leader on this issue. And I understand the importance of public health, the everyday things we need to do to make our citizens healthy, to prevent bad things from happening, to have wellness. That's an important part of the role of government, to really have good public health so we can extend life expectancy of every single citizen. And I also understand the importance of everybody in, nobody left out. We've made some great strides in Illinois. We have to say that our state is a leader at getting children insured, and that's a great victory. And many people here worked on that victory, and it should deserve a lot of credit. I believe our veterans should be included, and I worked on that and got them included. But I want to make sure everybody, no matter who you are, gets decent health care. And I think we can do that in Illinois and be a leader in that state, in that area, and we can do it with good old-fashioned grassroots democracy. That's what this campaign believes in, organizing at the grassroots level. That's what I am. I always have been that. By dint of circumstance and fate, I was sworn in as governor of Illinois on the 29th of January. Pretty tough time, I can tell you that. Who in America has ever had to assume the office of governor at a more difficult time? We had a terrible budget deficit, our national economy was very slow, and we had an integrity crisis in state government. I've stabilized our government. I've worked every day for everyday citizens. I think we need a good governor like me who's going to stay on the course and get the job done for everyday people and help make the will of people the law of the land. Thank you very much.
Let's give Governor Quinn and Comptroller Hynes another round of applause. Thank you very much.
Good job.